All right, you guys, let's talk about healthcare today. Today is July 11th. It's a Sunday. Hope you guys had a good weekend. I don't know if you guys can see the time here, but it's almost midnight, so it's about to be July 12th. But I'm gonna count this as the 11th. So pretty much something interesting that happened over the weekend. Nancy Pelosi. So Democrats, they want to take over big pharma. I think that's cool, right? Nobody likes big monopoly corporations. I mean, the pharma industry isn't a monopoly, so it doesn't really apply to that, but there's a bunch of issues related to big pharma. So it's been reported that 14 of the largest drug manufacturers in the US spent $577 billion on stock buybacks and dividends between 2016 and 2020. That's a whole lot of goddamn money. And to put that into perspective, 577 billion, US healthcare spending, well, in 2019 was almost $4 trillion. So 577 billion, that's 15%. And of course, this was done throughout what, 4 or 5 years. So, but still, never, that's like a whole bunch of money. Um, the big pharma companies, they argue that the price increases on prescription drugs help innovate, incentivize researchers, better development and all that. And we'll get into that. There's a whole bunch of companies. So Abivai, Johnson& Johnson, Novo Nordisk, and Amgen, they're on the stock market. Um, and they've been performing okay, I guess. And if you don't know, when a company buys their stock, the stock buybacks, that's to they're manipulating the stock. So whenever they report earnings, so there's an EPS, earnings per share, and as a company buys back its own shares, it dilutes the amount of shares that are outstanding or available to the public. So the less amount of shares that are available, you know, it's limiting the supply. So when people buy up the stock, there's less to buy from. So there's that supply and demand that it affects. And then the EPS is also affected in damn, I'm blanking now. I don't know what that word is, but yeah, it's some bullshit, but it's it's a method that they do to falsely improve their stock price. But yeah, and if you didn't know, Nancy Pelosi, she's a legend when it comes to trading. Her husband as well. This is all public information. She's into Google, Amazon, Apple, Nvidia. And yeah, damn, they're pretty good. Insider trading, I don't know. I hope not. But yeah, so this reminded me of a certain story. So this dude here, I don't know if you remember him. This was way, way back, a couple years back. So this little asshole, I don't know. I think he's an asshole. He's a fucking douchebag. He bought, was it the patent? I'm not too sure, but Daraprim was $13.50. Overnight, it went up to $750. It's crazy. And he was saying, yeah, this drug is rarely used by the population. It's such a minuscule impact on the overall system. It's a little asshole, but the people that actually need it, fuck, that's so much money. And, when you have your private insurance, of course, it really depends on insurance, right? And I think it also, so I mean, Daraprim, this drug, it wasn't just that time. So from 2010 to 2011, they went from 660,000 in sales to 6.3 million. That's when they were selling about 12,700, right? And then it just kept on the price kept on increasing. Then through time, the number of prescriptions shrank to about 9,000, right? Fuck, that's a pretty good drop. And Medicaid and certain hospitals, they can get the drug cheaper, but private insurance, Medicare, and some hospitalized patients, they're gonna have to pay a price closer to that list price. So this little asshole, yeah, I mean, yeah, nobody likes that dude. He was a hedge fund manager. care about the money. I guess he's smart. You know, if you can abuse the system, people are gonna abuse it. So that's what we have to prevent. So yeah, Nancy Pelosi, she made no comment on whether the HR3 bill was going to be a part of their plan. It says, yeah, we will see how we proceed there. Yeah, she made no comment. If you're not familiar with the HR3, it's the Elijah E. Cummings Lower Drug Costs Now Act. And this one passed in the House in 2019. That's when Democrats were in control of the House. But then in the Senate, the Republicans, they said, fuck no, hell nah. And they stalled it. And that's where it pretty much ended, I guess. I don't know if you can call it ended. So pretty much this bill, the HR3 bill, it was going to negotiate drug prices and other stuff related to Medicare. So, for example, they were going to negotiate maximum prices for drugs 120% the average in other countries such as Australia, Canada, France, Germany, Japan, and the United Kingdom. And if there's no information available, it would just be 85% of the US average manufacturer price. That's a pretty good method, right? I would think so. But, from a provider standpoint, you can argue that Medicare would always pay shit reimbursement, but I don't know, there's a whole separate debate. And yeah, this bill included a whole bunch of stuff. It would reduce the annual out-of-pocket spending threshold. So previously, it looked like the out-of-pocket maximum was $6,500, and it's gonna drop that to $2,000, or at least that's what the proposed amount is. Um, so yeah, I mean, that sounds pretty good from my perspective, right? But if the money makes sense, if the numbers make sense, it's a good idea to me. Um, so price transparency. So, you need to give access, public information. Fuck, it's like midnight. Yeah, it's already midnight. So certain drugs that cost $100 or more, we need to see that price transparency. But compliance is a whole other issue. I know hospitals are subject to price transparency, but compliance is pretty shit. Um, that's probably would be another day, another video for that. So yeah, we can pass this price transparency, but when it comes to compliance, I mean, shit, we gotta see it get done. You gotta enforce that shit. I know Trump, I don't know, he kind of was a little too lenient with the Affordable Care Act stuff. So I don't know. I think people are just being too relaxed. And with this HR3 bill, they wanted to provide dental, vision, and hearing coverage under this program. So currently, Medicare, there's pretty much four main parts to Medicare. Medicare Part A covers inpatient or hospital setting. Medicare Part B covers anything for outpatient or medical services. Medicare Part C is the Medicare Advantage. So, Medicare is a government insurance. If you want to keep your private insurance, you can still get your private commercial insurance, you know, like Medicare wise. That would be under Medicare Part C. And the reason why people still want that, the Medicare Advantage plan, so that's what they're called. Medicare Part C is Medicare Advantage. And these MA plans cover dental and vision. So that's why, people want to get it, because Medicare Part A, Medicare Part B, they don't really cover that type of services. So with this HR3 bill, it'll be covered. And then Medicare Part D is prescription drugs. And yeah, this bill is pretty good. They're going to provide funding for the opioid crisis. And yeah, I think it's a pretty good thing. So we'll see how this plays out. And yeah, I'll keep you guys updated. Hope you guys had a good weekend. I'll catch you guys later.